Okay, hi. I just got back from Forrest's first official neurologist appointment, and I wanted to do a video update because I don't want to type it all, and I'm also wanting to recap the entire story for anyone who doesn't know it, because I'm looking for some advice because I don't know what I'm doing, so I need moms with experience in this area because I don't know what to do from here. So, for those of you that don't know me well, my son is when he was 4 months old, he fell off my bed and hit our hardwood floor right on the front of his face really hard. He cried really hard, but he was, consolable. He did calm down. And about an hour later, when he settled in for sleep, I was nursing him to sleep, and he had a seizure. And let me describe the seizure because that's apparently important. So, he was nursing, so he actually bit down on my nipple. I felt his jaw lock, and he froze for a second. He stiffened up, and then his whole body convulsed for, I would say, 45 seconds. It was about, 1/1000, 2/1000. I would say about 45 seconds. And I kind of panicked, but I didn't take him to the hospital right away. After some convincing from other people, I decided to take him in. He didn't have a fever. They took his temperature, and they said, sometimes it happens, don't worry about it unless it happens again. That was July 23rd. He's 8 months old now, and today's November 17th, I think. So, since then, he has now had 16 seizures. Varying from 10 seconds long to a minute and a half long. A minute and a half is the longest one that he's had. All but 2 have been while he's asleep. 2 have been while he's awake. Once while I walked in on him while he was playing on the floor. He was laying down, and by the time I got to him, it was over. And I didn't really want to count that one, but I really feel in my heart like he was having one. And then he had one as I was pulling him out of his car seat, and by the time he got to my chest, it was over. So both of those are hard to say. Were they there? Were they not? But I would like to count it because, he's had so many other ones. But all of the other ones have been while he's asleep, going into sleep or out of sleep, like getting, wrestled out of sleep. I have never really seen anybody have a seizure other than him, and so I started doubting myself. Is he not really having them? What are these? But then my husband saw one, and he's like, those aren't very bad, but that's definitely a seizure. So I wasn't crazy. He's seen it too. It's not just me. So one time he had 2 seizures in one day, and his pediatrician said, okay, that's it. You need to go to UC Davis emergency room. So we took him in, and we stayed overnight, and we went through all the hell that they put you through. And he had an EEG, he had a CT scan. They were worried about brain damage from the fall. There was no brain damage. The CT scan, and he looked great. He's developing totally normal. These seizures are not affecting his day. However, if you chart them, they seem to be increasing in frequency and length. So, that's a little concerning, but it's kind of hard to make a pattern out of just 4 months and 16 seizures. So, that's a little difficult. So, we went to the emergency room because his referral was taking a while to go through. Well, his referral went through, and that's where we went today. So he went and saw his neurologist today, and when we got there, he saw the same neurologist who saw him in the ER. And when we went to the ER, they told us, the EEG, their exact words on the EEG was, there's nothing terribly alarming, so don't worry about it for now. We're not going to medicate him because we don't feel like he's in danger. He's doing great. And, clearly, I was staying calm about it, so it wasn't affecting my day any necessarily. So they just said, just keep track of it. And when you do a follow-up appointment with a neurologist, just lay it all out again. They went through our entire medical history. We have a lot of family history with seizures. Most of them grew out of it as teens, but a couple of them were medicated. That's on my side and my husband's side. I feel in my heart these are happening. So we went to UC Davis today for his neurologist appointment. I drove, we stayed overnight. I drove 2 hours to this appointment because I felt I had been told this appointment is important. We need to go, despite the fact that he had been to the ER. So we get there, and the nurse comes in and is asking us 100 questions, having me re-describe everything, having me lay out all of the days and lengths and times of all of his seizures. She does a family tree chart of our family history, everything from migraines to mental disorders to everything that could possibly even show a sign of anything that could be wrong with him. And let me just say, I never intended to medicate him. I don't feel like he needs medication. I feel like the medication is riskier than the actual seizures themselves. So in his case, I don't feel like he needs to be medicated. I originally was very concerned because I was worried about the brain damage. I was worried that why after this fall, now he's having them. But they told me he would probably be having these anyways. It was probably just a coincidence. Like maybe his seizures are injury-induced. Maybe they're illness-induced. He seems to have more when he's getting teeth or is sick, congested. So they seem to be related to illnesses or related to injuries. And so there was, that was kind of the pattern. He's consistently had, about 4 a month, whether it's like 2 1 week and not any the next, or 1 a week, but about 4 months. And so we get in there, and the nurse does everything, and she was, okay, well, the neurologist will be in. The neurologist came in, and it was the same lady who saw him in the ER, and she is the one who saw the EEG, told me there was nothing terribly alarming, but that she did feel like he had a seizure disorder, and that we would keep following up on it. So that was the last thing that doctor said to me. I come in today, and she said, very snarkily, your son is not having seizures. And I said, what do you mean? She said, I do not believe that he's having seizures. I said, well, then what is he having? And she said, I don't know, shivering or something. I said, I don't think so. She said, well, describe, and they kept saying, well, is he stiff when he does it? And I said, I don't really want to answer that because I'm not quite sure what you mean. His body kind of did a freezing motion, and then his entire body convulses. He shakes from head to toe, his feet, his arms, his chest, everything, like he's shivering, but his whole body does it for a whole minute. That's not normal. That's not shivering. That has to be something. But I am open to anyone that might have any suggestions on what else this could be. But I would say, considering our family history, what I'm describing, everything I'm seeing online, other people's experiences, this sounds like seizures to me. So I give her the benefit of the doubt, and I say, okay, if they're not seizures, then what's going on? And she treated me like an idiot. Like I was this crazy mom. She told me I'm probably just over worrying, and that these are definitely not seizures. And I said, but you're the one who told me before that they were that he has a seizure disorder. Like, you're the one who did that. And she said, well, I'm not doing that anymore. So I'm revoking that diagnosis, and I'm sending that to his pediatrician that he does not have seizures. We are not doing any more follow-ups. He does not need to be seen. And, whatever. And I said, okay, on the off chance that you're wrong, I don't feel like he's, his development isn't affected, but clearly he's at risk for that. So I feel like this is something that I should at least be paying attention to. And she said, if you really feel like you want to do that, the next time that he has one of his episodes, you can try to wake him up. If he doesn't wake up out of it, then that's a seizure. If he does wake up out of it, then you're fine. Try that a couple times for your own comfort. She said, but I can't do anything until I see one. And I said, well, he doesn't have them that often, so how do we, catch this? She goes, well, you need to get a video of it. Which is really difficult for me, because in that moment I'm so focused on, timing it, telling my brain this is happening, but I really need to wrap my mind around, I need to have my phone on me all times, and I need to get video, I know that. So I said, there's nothing, you're not going to tell me anything to look out for, you're just completely revoking this. I said, what if he has another one, and it is a seizure? She said, well, then we will start this process all over again. And this is what pisses me off, because we just waited 4 months for this referral, and that's me calling every week, pushing this, and advocating for him. And it is hard. It's hard to do, and then to watch him go through these tests is really difficult. So I had a friend tell me about genetic mutation that can happen. Anyways, I wanted to get some genetic testing on him, and I said, can you please, since we're here and we made the trip, can you do a blood test on him and do some genetic testing? And she's just very firm. I told you, he is not having a seizure. These are not seizures. You need to stop worrying. You need to stop doing anything. You need to stop Googling. You need to stop doing everything. He's not having seizures. I'm not doing testing. And I'm just like, what's a blood test? We're here. I'm concerned. And she basically just made me feel like my concerns are not valid. I'm crazy and I need to stop. And she's like, why aren't you accepting this good news? And I said, I'm not saying that I want my son to have seizures, but what I'm saying is these are seizures. I don't know what else to say, that he is having seizures. Okay, fine. He's developing normally. Maybe I don't need to worry about them, but I don't want that diagnosis revoked, because then if something does happen and these get worse, then we're back to square one. And I don't want to spend 2 nights in an emergency room. Like, I have a life and I have a family and I want this to be as easy as possible. So now I'm just kind of stuck. So now it's put in his chart. She wrote a note to his pediatrician. Mom was wrong. She's overly concerned. These are not seizures. Please, like, take this out of his chart. And I'm just, like, really, really frustrated. I don't know what to do. So, anyways, if anyone has any advice, or maybe you can think that, if you have an idea of maybe what it is other than seizures, but I don't know what else what it could be. He's not shivering. This isn't my first kid. This isn't my first rodeo. I'm not being paranoid. The last thing I want is for my baby to be picked and prodded and poked. I don't want that. But if there's something I need to be concerned about, then I'm going to be concerned. I want to make sure that he's okay, and that maybe these seizures aren't a sign of something else. And I just want it set in stone that either that this is a seizure disorder or not, because that can affect other areas of health. It affects what medications he can take in the future. It can affect, so many things. And I mean, I'm still going to do my part. I'm still going to track. I'm still going to document. I'm still going to try to get video. But I feel really stuck in the medical side of it, what I can do, because I'm terrified that what if he starts having, like, fits of them, and it does start affecting his development, and it takes us 6 more months to get back into the neurologist, and it's her again, and she's awful. She had absolutely no bedside manners. She did not care. She acted like I was wasting my time, and every time I wanted to ask her more questions, she was looking at me like, why aren't you packing your stuff? You need to go. And it's so frustrating, because this is my baby, and she didn't want to give me the time of day. Like, I was just the biggest moron in the room. So I'm looking for any advice. Should I try to find a different neurologist? Should I go back to his pediatrician and push this? Should I just wait it out? Try to get video of it? I don't know. So, help me, please. And thank you for any information that anyone sends me. You can private message me. You can comment on here, wherever. My life is an open book, so don't worry about personal things. So, thank you in advance.